Cancer. Once one of the most talked about diseases in the world. But now, in the wake of the COVID-19 pandemic, it's almost been forgotten. A point that the World Health Organization highlighted on World Cancer Day on Thursday. 1 in 3 European countries are now registering diagnosis and treatment delays, something that is directly impacting the chances of survival for hundreds of thousands of patients. And it's a reality which one Belgian oncologist confirms.
In April, we had a decrease of 44% in newly diagnosed cases. In September, they were down by 14%. So diagnoses were increasing by the end of last year, but that 14% is still 5,000 people with cancer that were not diagnosed.
4 out of 10 patients were not receiving, for example, their chemotherapy at the right time. So really it was having a devastating effect on cancer patients and cancer services right across Europe.
The European Commission is promising to develop contingency plans in order to respond to any future events. And its new Beating Cancer plan, launched Wednesday, covers many areas, from early diagnosis to reducing cancer-related consumption habits. But for now, people need to be reminded that they must go to the doctors if they have symptoms of the disease.
People have their minds so focused on this pandemic because the images are so disturbing and stressful. There are people in dramatic economic situations too. So a lot of people stop taking care of themselves and their health for the time being, deciding to wait to go to the doctor even when they have some worrying symptoms. One of the first cancers that was not being diagnosed was skin cancer. So there is no reason not to go to see a doctor if there is a sign or to have a screening.
The European Cancer Organization is proposing that governments launch new media campaigns to raise the public's awareness as part of their 7-point proposal to the EU. But they also want more funding for research.
In that first phase of the pandemic, we saw a drop, for example, in clinical trials activity and also in translational research, sometimes as much as 80%. So it's critical that we continue to do research. It's been shown how research has led to the quick development of vaccines for COVID. We also need to make sure that we continue to invest in research for cancer to find better ways of diagnosing patients, but also treating patients.
The European Commission says it will establish a new cancer inequalities registry, as well as a knowledge centre on the disease, later this year.